Jar Oil. The company have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country with the most competitive prices in the market.
Excellent jam, si Wave.
Yo, apply. Yo, luta do dede. Luta mo nulo jël moto nga andil ma xaalis. Hello? Ano lay waxal?
Bisul mu fine.
What?
Bisul mu fine.
Oh, yes!
Wave Axina Gambia. Deposit and withdraw money, pay bills and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. At Wave. Bisul mu fine? Wave. Your money is yours.
It's 11 minutes past 8 o'clock in the morning here in the Gambia on Tuesday, the 4th of November, 2025. It's Coffee Time with Peter Gomez coming to you live on radio 92.1 on FM, online www.wcr.gm. Thanks for joining us. And this morning, we are honored to welcome two trailblazers in Gambian medicine, doctors whose expertise and dedication have redefined what's possible in our healthcare system. Joining us is a surgeon, a lead surgeon, a consultant surgeon. Alongside him is a distinguished consultant urologist whose work in diagnosing and treating urological conditions has been vital to improving patient outcomes and advancing specialized care. Doctors, welcome. Who is who? Let's start with gentleman closest to me.
Well, I'm Professor Augustine Takure. I'm a urologist and a kidney transplant surgeon.
Fantastic. You're welcome. Dr. Takure, Professor Takure, and...
Good morning, Uncle Peter. I am Baukar, so I will probably make a little bit of correction.
Okay.
I'm not yet a consultant. I'm a senior registrar.
What's the difference between a consultant and a registrar? Senior registrar.
Right. So to become a consultant, you go through a residency training program.
Okay.
And the training program in the West African College of Surgeons is in two components. You have the first part of the training called membership, which runs for about 3 months. So that's 3 years. Yeah. It's a 3-year program. Mm-hmm. And then you write exams. So if you pass that exams, now you become a member of the West African College, equal also to a specialist. Now from there, you go join the second and the final leg of the training to become a fellow, which is a consultant. And that takes another 3 years.
Goodness
so
me.
that is the program I am doing now,
okay.
And I'm at the tail end of that training program.
Oh, fantastic.
And Prof. Takure is one of my trainers.
Fantastic, fantastic. Good luck with that, all right? Now, what are the most common urological and renal conditions in the Gambia? Let's start with Professor Takure.
Well, the commonest urological condition is prostate cancer in the Gambia.
We should get a month for that. You know, the the women have a month for breast cancer awareness. We should also
we're actually working on it.
Okay.
Prostate cancer is the commonest. But the common kidney disease, which is a silent kidney disease, is the end-stage renal disease, chronic kidney disease, when the kidney stops working properly and needs an assistant. So that's usually the patient presents to the nephrologist, and the nephrologist take the lead by giving some replacement therapy. And that replacement therapy is attaching patients to a machine, which is called the dialysis machine. The machine is actually a kidney. It's a big kidney that helps to filter or perform the work of the kidney. So they usually take the patient towards the machine. Most people don't know that that's what it is. It's actually a big kidney outside the body. So, but the urologist comes in to help give a sustainable treatment for those who have such kidney failures. And that means you will replace what has failed. The organ that has failed is the kidney. So we'll replace that kidney by performing a surgery. The surgery is performed on 2 people, either living or diseased. In West Africa and in most of the African countries, we perform the living operation. So the living operation means you look for a relative of the individual whose kidney has failed. we carry out some tests to see if they are similar, if they are related. Because if they are not related, if you bring any foreign organ into your body, the body will fight it and destroy it. So you must be related. And then once we find out that you are related from the test, we also need to suppress the body from destroying the kidney. So we now go ahead and do the transplant. So we do the first surgery on the person who is giving his own kidney, his or her kidney. And then the transplant itself is the kidney that you have removed. You put this in the individual whose kidney has failed. So you end up having 3 kidneys, the 2 failed kidneys and the extra kidney that is now working. So that's the kidney transplant, as simple as that. But it's a very complex procedure. But there are other conditions that are coming up of kidney disease because we are beginning to be more enlightened. We are eating foreign foods. So we start having what we call the stone disease. And this stone disease is one of the reasons why the urology unit is established. It's one of the reasons why there's an advanced instrument available now in the Gambia for treating this kind of disease. It's called endourology equipment, where you don't need to open the individual to treat, but you can just go through the holes in the body, the tubes in the body, and you get to where the problem is, and you can break the stone. These are advanced technology. It's available in the Gambia now. So we can actually treat such stone diseases now.
Very good.
So that is based on the improvement in the society. I mean, what the government is doing to establish such. Of course, I must recognize that the availability of this urology theater was sponsored by the FAB. That's the president's first lady. The first lady with international bodies actually worked.
Fatu Foundation.
Yeah, they did a fantastic job. They actually helped. I was around. They actually helped in renovating the theater and make it a standard theater comparable to any theater in the world.
Oh, really?
Yeah, it's comparable. If you get into the theater, you may not want to go home because it's so comfortable.
I'll come around to verify. Not that I'm doubting.
So we treat the stone diseases. Then in the men, of course, we are still talking about the kidney. So we have such kidney stone diseases. There are other kidney diseases that are coming up. People are born with it, but they never knew was there. So the kidney gets bloated up. It's not releasing the urine, so it gets expanded and bigger. So we can do what they call a reconstructive surgery for such conditions. You can go through minimal invasive, or you can do an open. Of course, we know life. In life, we must procreate. The man must be able to perform his duty.
Life, yeah.
So he has 2 roles. He must be able to do his duty and also help in producing human beings. So the urologist is key to that. And fortunately, we have the equipment in the Gambia now.
Very good.
It's called laparoscopic procedure. We do this procedure by making buttonhole incision in the body. 3 buttonhole incision. The patient won't even know you've done anything. When he wakes up, he's just going to see tiny pieces of plaster. And he goes on the next day. So it's a fantastic facility that is available.
So the
in
equipment
the Gambia.
is there, and the know-how,
not just
and
there.
the know-how is
not
there.
just there, we are doing it.
Okay.
We are doing it. And interestingly, this country is blessed. The cost of the treatment is fantastically unbelievable.
Low.
It's too low. And that you'll be wondering, are you sure that this thing is being done? Because it's extremely low. It's like you're buying a bottle of drink.
That's good news.
So that's what the government has done for the citizen. And the citizens are not, they don't really know it's there. But it's there. It's something that is done.
Well, it's good that you're coming on radio to tell us that it is
it's
there.
It's done.
People will,
and then we also have the male disease, which is not a cancer, but it disturbs a lot of men, which is the large prostate. All men are entitled to it. It's just few that survives it. About 62% of men in Ghana will have it. In my country, up to 50, 70 will have it. Only about 30% are spared of the simple disease. But the beautiful thing is...
Do we know the figure for the Gambia?
No. That's one of the reasons why I'm here.
Okay.
In fact, let me first acknowledge openly that I am here courtesy His Excellency, the President of the Gambia, Adamu Barrow, who single-handedly contacted my president, His Excellency Ahmed Tinubu, to release me to the Gambia. So I must acknowledge that. Without him, I will not be here and be talking to you. So he brought me back. So now let's continue. So this simple disease can be treated without cutting the body. We are doing it. We work as a team. So we are doing it. Any one of us can do it. But we usually like to work as a team. We will not cut the body. We just go through the pipe that brings urine out. And then we'll pass the instruments in, and then we'll be removing the chips. Very beautiful surgery. Is available in the Gambia. Initially, it was only available in the private facility, but it's now available in the teaching hospital. So they should know that
where a greater part of the public can access it.
Yeah, where they can access it at a very ridiculous price again.
You're probably comparing our prices to prices in Nigeria.
Because
but the purchasing power in Nigeria cannot be compared to the purchasing power here.
The point is, the instruments are the same.
Exactly.
It's the same cost everywhere in the world.
True.
So for the price to be so reduced means that the government is actually keen about the health of the citizen by bringing that price so low so that they can be accessible to them. So manpower, we are working on manpower. This country has just one urologist, one indigent urology in the whole country. And it's a lot of work on him. But thank God, we are grooming 2 urologists who, by the special grace of God, next year will become full-fledged urologists. So the Gambia can have additional 2 urologist consultants. So that increases the manpower. That's a very good news for the country. Okay. So we are working on that. That's what Dr. So told you at the beginning. Yeah. So by God's special grace, we are confident that we will achieve that by next year.
Okay. Yeah. Dr. So let's bring you in.
Thank you.
What exactly does urology cover? And why is it such a critical field in medicine?
Right. Thank you, Uncle Peter. Urology basically looks at the urinary system. That is all the way diseases of the kidneys to the pipe. You know, the kidney makes urine, and the urine gets to our bladder through a small pipe called urethra. So diseases, that small pipe that connects the kidney to the bladder also do encounter many surgical diseases, ranging from stone diseases to inflammatory diseases to cancers to congenital diseases. Then you go all the way down, conditions of the bladder, right? Again, ranges from stone diseases, stones form inside the bladder, cancers, inflammatory diseases, some form of infections, be it TB, be it schistosomiasis, and others. And of course, going down below the bladder, we have what we call the prostate gland. Prof was just talking about that. Diseases of the prostate gland are huge and could be very troublesome. This again range from malignancies like prostate cancer, which is quite common, and enlargement of the prostate gland, because as we age, the prostate gland naturally also get enlarged, and then when it enlarged, it has consequences, because the urine that comes from the bladder to the outside passes through the urethra, and the prostate is directly under the bladder, and when it enlarges, it narrows down that pathway, and then patients do have symptoms as a result of that narrowing from the enlargement. And I must say, one of the commonest presentation to the emergency.
That was going to be my next question. Yeah. The commonest, urological conditions that you come across in the Gambia.
Yes, in the emergency, the commonest presentation is usually urine retention, acute urinary retention, meaning the patient has sudden inability to pass urine. And that could be very painful. Imagine when one has the urge to pass urine and there's no way of the urine coming out. So that's one of the commonest presentations at accident and emergency. And most of it is as a result of enlargement of the prostate. Of course, there are other causes as well. Then you go down to the external genitalia. In the man, the penis also has many other diseases. Again, from cancers, to infectious diseases and other benign diseases such as urethral strictures that would have resulted from infection or trauma. And again, around the scrotum, I also, diseases of the scrotum are there, the testicles and all that. Sorry for the language, I'm sure some, yeah. Again, there are a whole large basket of conditions that affects the testicles. And of course, another important component that we also look at is fertility matters. Usually people think if a couple are not able to bear children, it's usually the woman in our culture, and then men will resort to getting additional wives. Meanwhile, a good part of the contributing factor to infertility of couple also is male factor infertility. Prof mentioned it. For some reason, some men are not able to produce viable sperm cells. When they ejaculate, something will come out, but that's basically does not contain sperm cells in some cases, or the numbers might be so low because you need huge numbers to be efficient in achieving pregnancy. So we also see around conditions around that, as well as even erectile problems. Men also do battle with erectile dysfunction, and this is we see a lot of numbers. We've not yet published, but we are seeing a lot of numbers among the young population.
When will you publish?
Yes, we
are working. We are actually working on it. I can assure you that by next year you see a couple of publications from the Gambia. All right.
And just going back to somebody wanting to pass urine and not being able to because of enlarged prostate. So what do you do now?
Right. So I must say this is quite common, and sadly, some years.
Do you operate to reduce the prostate, or what do you do?
Yes, sir. I was just trying to
to build up to it.
To build up to that, to express how bad the situation was. You'll see men carrying pipes, we call it catheter, to the urine pipe, to the penis, for years.
Wow.
Yes. Prof just mentioned that over the years, we have only one urologist, that is Dr. Jah. I think the country, Abubakar Jah, the country owe him a lot of gratitude. He could have done what others have done and leave the country. Yeah. And you imagine, even a person who's unable to pass urine have to travel out of the country. But he held the fort while some of us training to join him. I will use this opportunity to thank him. I think
we all should.
I think the country owe him that gratitude. Now, men carry this pipe for years before they have the opportunity to get this thing sorted out. But usually, when they have enlarged prostate, the management depends on how bothersome the symptoms are. If the person is so bothered with the symptom, first we start with medical therapy. We give them some medications that will relax the pipe that passes through the prostate, which is enlarged, right? So that will help them to pass urine, or other medication that will shrink the prostate. So some patients...
So there is, we have that possibility of shrinking the prostate.
Yes, with medication first, right? Or making the pipe wide, more relaxed, and then give it some bit of, space to pass urine. That's the first medical intervention, that is, you give medication first. Now, if patients are given medication, you follow them up, and you have a score, that system that you use to determine whether this is giving you desirable results or not. If the results are not desirable to the patient, it's the patient who decides here. Or, of course, there are other factors also that come into play to decide whether you need to operate or not. So not everybody who have enlarged prostate, straight operation, no. We have protocols to follow. First, medical treatment, if the symptoms are so bothersome. Now, the next level is operation. That is, if there's a failed medical therapy, or the patient have other complications, such that you don't want to make any attempt on medication because of other conditions, right? So when you decide on operating, now you have two protocols to follow in the Gambia here. One is open surgery, meaning you take a knife, you make about 10 centimeters of incision, right? You go deep down, you imagine where the bladder is, way down. It's a deep pelvic surgery, very complex surgery, and inoculate the prostate, get the prostate out, right? And then we join, and then after 2 weeks, the patient will be expected to pass urine normal. But
explaining it alone sounds so painful to me. It's like, it's being performed on me.
Yeah, it's a complex surgery, but then the patient will be on anesthesia, and after the surgery, the patient will be on pain medication. Yes, it could be painful. And then, of course, there are complications that are associated with every surgery, and prostatectomy, simple prostatectomy, is not an exception. So, but there's also another form of surgery. Prof was mentioning that, and that is what we call minimally invasive surgery, which is TURP, that is transurethral resection of the prostate. You pass a telescope through the penis, right in up to the prostate, and you scrape the prostate gland, the enlarged prostate gland, which is causing the obstruction. You scrape it out until you have a good channel. There, the patient is able to pass urine subsequently. You keep the catheter just for 24 to 48 hours, and the catheter is out. Patient get up and go home with no cutting, no infection from surgical wounds and all elements. And we have these services now. So these are one of the highlights in our unit. So basically, in short, these are the approach to the management of a patient with an enlarged prostate gland. Yeah.
We're talking this morning to Professor Takure and Dr. Sow, renal and urological specialists. And how do lifestyle and diet contribute to renal and urological diseases?
Well, before I answer that, let me first make a correction. We've not done kidney transplants in the Gambia.
You've not done?
Yeah, we are working with the ministry to see how we can establish it in the Gambia. And very soon we will do that. So how does lifestyle affect kidney disease? The commonest lifestyle that affects kidney disease is cigarette smoking and eating westernized food, taking a lot of dairy products, milk, and eating a lot of beef meat. This increases the calcium level and predisposes the individual to stone formation. So when they form stone, they form the stone in the kidneys or in the bladder. And once the stones are formed, they are like the stones on the ground. They block the pathway for urine to flow. So that makes the individual to complain of severe pain that moves down the body and maybe associated with passage or presence of blood. So that's the lifestyle. Lifestyle also affects causes some diseases like the bladder cancer. Those who smoke excessively, about 40% of cigarette smokers are more likely to have bladder cancer. Lifestyle can affect the external genitalia. We know there are a lot of stress in the world, and some people try to kill their stress by taking some hard drugs. Some take medications that were meant for pain, for relieving pain. When they take such medications, it allows their private organ not to subside when it is erect. So they have a sustained, painful, terribly painful erection that may warrant an emergency surgery on the private parts. So that's taking excessive medications that are not necessary. So those are some of the ways that the lifestyle can affect. Of course, generally, lifestyle, careless eating predisposes to obesity. And obesity affects all organs in the body, not sparing the urological organs that we have enumerated.
And what about, early signs that, somebody has, either kidney issues or, urological issues?
Okay. For the kidney issue, the kidney is a very silent organ. Very, very silent organ. You have to be extremely concerned about your health to pick a kidney disease. But the earliest sign that you may have a kidney problem is that the amount of urine that you pass in a day suddenly reduce without any difficulty in passing urine. You just notice that the volume of urine is reducing and there's no pain. There's no pain that you can't pass the urine, but the volume reduces. And that's the earliest sign. If you overlook it, then it gets to the stage where the legs start getting swollen, the face gets swollen, and you have difficulty with breathing. Now, for the prostate, which is a common area of disease for the men, the simple prostate disease. The earliest sign is the man starts waking up in the night several times to pass urine. Normally, like you are taking coffee or you drink water late, you may wake up once and pass urine. But if you notice that you are no more waking once, you are waking 3 times. That's the earliest sign. But we as human beings have a way of explaining this away. It's because I drank tea. It's because I did this. So you delay that, and then it progresses to other symptoms, like passing urine frequently during the day. The number of times increases. The most embarrassing is, as we are talking, you just said, Mr. Peter, excuse me, and then you run out to go. So that's what we call urgency. That's very embarrassing. When you ignore the earlier side, then it gets to the stage of urgency that will start embarrassing you. Or when you are traveling, of course, you can't tell the pilot to wait.
No.
When you are traveling, when you are on the road and you are traveling, you just tell the driver that, driver, please wait 1 minute. You have to wait because you are pressed to pass urine. So those are early signs that the prostate has an issue or the kidney has an issue.
Is the Gambia investing enough in training specialists in nephrology and urology? Yes.
Enough is a big word, but they are trying. They are actually trying. Yeah. They started the postgraduate medical school, and with the onset of the postgraduate medical school, we've been able to groom some doctors who have passed the membership. I can tell you confidently that this year, 6 Gambians have become members of the West African College of Surgeons. 6. 5 of them passed the exam in April, and 1 passed the exam in October. And then we also have a qualified general surgeon who is a Gambian. He's a specialist now. Passed the exam October this year. So we are moving, but we have not done enough because we need to encourage more people to come into the residency program. If people are not coming, they are not seeing the need to come, and they need to appreciate that this is their country. Nobody is coming to do it for you. You need to take hold of what you have and stay behind. The facilities to train is on ground. The postgraduate college has actually put things to train on ground, but we need people. We need to encourage them that the facilities are on ground for them to come for training.
You mentioned the West African
College of Surgeons.
College of Surgeons. How is the Gambia collaborating with international institutions for, people like you to stay ahead who are serving in the Gambia?
Maybe I can help there.
Dr. Saul should be able to help.
Right, Uncle Peter, I must say, I think one of the most striking activities that happened over these years is the postgraduate training program. I remember when I was a much younger doctor, medical training, many people think, the ordinary Gambian thinks, once you train, you graduate from medical school, you are a doctor, that's the end, right? No, it's a whole life, program. You train to end. So when we graduate, basically there was no future. It's like you are trained as a general doctor, you graduate, that's the end. How do you get to that level to become, a specialist or a member, and eventually to be a fellow, a consultant? There was no plan, no sustainable plan. Let me put it that way. No sustainable plan for that, because all along we had to find ways of going abroad and train, and it's very expensive to take people abroad and train. That's number one. Number two, if you take them abroad to train, some may not come back. Thirdly, while they are training abroad, they are not offering any service to home country. They are rather offering free service to another country where they are training. Dr. Samadi was here a few weeks ago. They trained in Ghana. All that years they were training, they are providing services at the same time, because it's apprenticeship, right? And your home country is not benefiting. As we are training at home now, we have over 100 doctors who are in this training program. And now we have close to 40, if not more, who have completed the first 3 years of the training, and they are at different level of the last leg of the training, which is a positive development for the country. And this started in 2019. right? So I think by and large, a lot has happened, and a lot is also happening in the training of doctors. And while we are here, we are constantly offering service. At some point of the year, I was in Bansang doing urologic surgery, patients that would have otherwise been referred here. So we are able to stop there. And my colleagues also do go to the provincial health facilities and operate there. And again, the postgraduate training, bringing in all these professors to train, I think has been a big investment, of course, with partners and government. I think a small country like the Gambia, a poor country, being able to attract this level of and caliber of trainers is a big milestone, and we have started seeing the results. And we appeal once again to government to continue to support this program. I'm very sure if this trend continues for the next 5 years, we will be self-sufficient. To a great extent, we'll be able to continue to train our people to that highest level. And again, postgraduate training, I hope at some point we'll have Professor Gassama here, the postgraduate training coordinator. He will put more perspective to this, because postgraduate training comes with a lot of development. Some of the development we're talking about today in the health system, particularly in the teaching hospital, is as a result of the postgraduate training. Now, for any department or unit to start training under the West African College, you must reach a certain level of, in terms of human capacity, in terms of equipment, in terms of staffing. So they have a checklist. You must be accredited. The West African College will send a team of accredited. So they have to make sure you meet that basic minimum standard for the entire region. So this will force you to go up. Urology, we wanted accreditation. We have to fight very hard to make sure we get all this. And again, I join Prof. Takure, if you allow me, to thank the First Lady profoundly for sponsoring and supporting this urology unit. She entirely put her weight, on us or behind us, so that we get to this level. Without her, what we're talking about today in urology, we'll not be talking about it. Okay. You will either go private if you can afford, or you have to wait for many years. So I think we are very grateful to Her Excellency and all her partners and foundation.
And just maybe in rounding up. So what can people do, to help their kidney and urological health? You've just talked about smoking, so people, should try to give up smoking. What else? Drink a lot of water, drink less coffee, like...
No, we won't go to coffee. You take take water. Water is very good for the body. At least for the adults, you need about 3 liters of water per day.
3 liters?
3 liters of water, of liquid.
Okay.
Per day. So if you take 3 liters of liquid, your kidneys will work very well. We discourage smoking as much as possible. We discourage excessive alcohol ingestion, because alcohol in moderation, you can't moderate anything. So it's better to just stay away from it. So as much as possible, discourage alcohol. And we discourage reckless, indiscriminate interaction between male and female, so as to reduce the chances of infection. Because if infection sets in, it blocks the pipe that brings urine out from the bladder. And when that happens, it could cause the acute, sudden inability to pass urine that is very painful, which needs a lot of expertise to reconstruct. We are beginning to see such conditions, narrowing of the urethra. We call it urethral stricture, but it's just narrowing of the urethra from reckless lifestyle. We also need to be very careful when we are driving. We should be careful at our place of work, particularly the bricklayers, those who work in construction companies. They should have machines that will actually take them up and bring them down slowly, because if they fall from such heights, they could injure their lower parts of the private parts, and that will cause a serious problem later on in their life. Of course, we must look at our children. Like I said, their urology means life, and without the balls, the testes, there is no life. So our children, we need to organize outreach in schools where we can do some examination of the males and see if their testes are actually down, because the testes needs to be out, the balls needs to be out for a warmer temperature. The temperature in the body is very high. It will kill.
Are there cases when they don't come down?
There
at
are
all?
many cases where they don't come down and they don't even know they are not down. So we may need to arrange outreaches to go to schools, to give them a health talk and examine them and pick those ones early so we can operate on them. There are also male children who have who leaks urine underneath. We need to check those ones. Of course, there's an aspect that overlaps between urology and gynecologists. That's our women. You know, when our young women are married too early to a very big man, they carry a big child, big baby, fetus in there, and then in the process of delivering, they injure their lower part. So the bladder can be injured. The pipe that brings urine from the kidney can be injured. So we need to talk to people that early marriage should be discouraged for young kids, young girls. They should try and reduce the early marriage so as to reduce the occurrence. They are very embarrassing conditions. A female that is leaking urine is very embarrassing.
True.
Of course, men don't worry. They will still have something to do with the woman, but she will feel like an outcast. She will feel depressed. She won't want to go out. So if we give them such health talks, it can help reduce such a burden of disease. Of course, urology, like I said, I always say it is life. We need to be conscious about our life, our lifestyle, and be conscious about the people around us. And we also need to encourage the government to establish kidney transplants in the country. About 46 per million people have kidney failure in this country. If you look at a population of 2.8, then you are talking about 128 that we have kidney failure and may need kidney transplants. Of course, dialysis is free, but dialysis doesn't sustain life. It's just a temporary thing. The ultimate is the kidney transplant. So it would be nice if the government can look into kidney transplant. It will save the government fund. I'll give you a reason why it will save. An average kidney transplant in Egypt will amount to about $600,000. Okay. If we do that in Nigeria, it will be about $750,000. And if you have the facility, you won't need to pay that. All you will need to spend maybe about $150,000.
Oh, just that?
Yes, just that. Because you already have the equipment, you have collaboration, you have the drugs that you can give to sustain them. So it will save the government a lot of unnecessary external spending. It's not just the person that needs the kidney. The families will go. The person who is going to donate the kidney will go. So you'll be thinking of accommodation, you'll be thinking of feeding. So it goes beyond the cost of one person. You're going to think of 3 people. So it should be nice if the government can look into that. And then they should also look at getting more equipment. We still need more equipment. Even though we say we have the cutting edge instrument, we still need more modern equipment like the lithotripters that can help us to fragment stones. So we need that, and we also encourage collaborations with international. That is already on ground. So, but we encourage more collaboration with international bodies. Fantastic. So that they can support. We can have an exchange program. Gambians can go out, spend a few weeks. Because if you ask people to spend months, they won't come back. So it's better they spend short. So they can go
It depends on where you send them. If you send them to go spend months in Guinea-Bissau, they will come back.
They won't want to go to Guinea-Bissau. So we'll keep on pushing the box to the government. But the people, the citizens should appreciate what the system is doing for them. EFSH is for them. It's a specialist center. And they should try and understand what they are doing, appreciate whatever they are giving them. Yeah.
Professor Augustine Takure, thank you very much for your time this morning. And Dr. Sow, we'll let you have the last word.
Right, thank you very much. I just wanted to say a few things here. First, one of our problems is patients don't come early. And some of the most serious conditions are painless. If someone is seeing urine with blood and it's painless, usually our people, if there is no pain, there is not much concern. They are concerned when there is pain. And those painless conditions sometimes are serious. One of them is painless hematuria, meaning passing blood urine with no pain, no one should sit with that. Don't wait for the next day. Come and see a doctor, come and see a urologist. Those are conditions that really need to be. And we see a lot of cancer cases, kidney cancer, bladder cancer, and they typically present with painless hematuria, right? And the other thing is, I just wanted to comment on quickly with regards to what Prof just mentioned, kidney transplant. Dialysis is not treatment. It's not an ultimate treatment for kidney failure. It's like you having some pain and just taking paracetamol. Meanwhile, the cause of the pain has not been solved. So we are just managing it. So the ultimate treatment of patient with end-stage renal disease is renal transplant. That kidney is done. So it's just there. So you need to replace it. And the way forward is renal transplantation. I'm aware, and then the Honorable Minister mentioned it here the last time he was here, and that they working on building a multi-purpose theater for kidney transplantation and also open heart surgery. At the level of EFSTH, we're working very hard to ensure we even start renal transplant before that multi-purpose theater is ready. So our new theater, urology theater, we design it in such a way that it can accommodate that, because you will need a twin theater. You need to harvest the kidney on one side and then transplant it in another. And then our theater has been designed to accommodate that. So, of course, as Prof mentioned, Prof is, by the way, is a trained renal transplant surgeon. And then we also collaborating with other institutions elsewhere so that we are able to start this as soon as possible, because the Gambian people need it. As you are putting patients on dialysis, more people are developing chronic kidney disease from hypertension, from diabetes, and others. So that number is going to continue to build up, and it will build up to a level. Even if you have 1,000 dialysis machines, you will overwhelm them at some point, because you are not weaning the patient off dialysis. And ultimate treatment is renal transplantation.
Jar Oil, the company, have filling stations across the country, and our rates are relatively cheaper than anyone else across the country. Jar Oil is the biggest producer and distributor of cement in the country, with the most competitive prices in the market.
Excellent jam, Wave.
Yo, apply. Yo, luta do dede. Luta mënuloo jël moto nga andil ma xaalis. Hello?
Bësal mu fay.
What?
Bësal mu fine.
Oh, yes!
Wave in Gambia. Deposit and withdraw money, pay bills and buy mobile credit without fees. Transfer money wherever in the country for only 1% fee. At Wave, Bësal mu fine. Wave, your money is yours.